In this unit, we are going to focus primarily on more of the lifestyle associated management options when it comes to obesity. We will also be covering the pharmacological options and bariatric options in future modules, but in this unit, we're really going to stick to talking about foundational nutritional concepts and dietary concepts, physical activity concepts, and then psychological and behavior change related concepts with respect to obesity management. So a good question to frame this whole discussion is how much weight loss is required for an individual with obesity? And the answer, of course, is it depends. It depends on that person. It depends on their comorbidities. It depends, yes, on their BMI, but also kind of what's going on beyond their BMI as well. As we go through this, it's important to keep in mind that these recommendations are for people with obesity and not necessarily for people that have, let's say, or want to lose 5 or 10 pounds, etc. So there's a lot of foundational concepts that are the same, but the messaging is mostly tailored towards healthcare professionals that are working with individuals with obesity. Something important to note is that as little as a 5% reduction in weight, not body fat percentage, in weight, total weight, can have a significant effect on a number of health markers like glucose tolerance, like blood pressure, improved HDL, etc. Often we think that a person with obesity has hundreds of pounds to lose, but as little as 5%, often about 10%, 15% even, maximum, it can make a massive difference in someone's risk of disease. For instance, in the diabetes prevention program, it was shown that every kilogram of weight loss was associated with about a 16% reduction in the risk of progression towards type 2 diabetes for those people that have pre-diabetes. So that's just one example, but this next slide, and I don't expect you to memorize this, goes over various conditions that are associated with obesity and how much weight loss is actually needed to help starting to improve those conditions. So in some cases, it's as little as 2.5% of weight loss to really improve things like glycemic control, when it comes to knee pain and more functional limitations. Again, 5 to 10%. And this is a really important thing to note because we want people to have realistic goals that are attainable. And when someone comes to us and they think that they have, half of their body size to lose, 50% of their body size to drop, their body weight to drop, that can be really discouraging. It seems really overwhelming that much. But if we can, reframe and let them know that as little as a 5% drop can have significant improvements in quality of life, that can be a lot more encouraging for the people we're working with. Okay, so a lot of what we're going to talk about in this module comes from the 2020 Obesity in Adults Clinical Practice Guidelines that were published in the Canadian Medical Journal and that were put together by pretty much all the big names in obesity across the country. A lot of people that are on the ground working with obesity. So I love this because it's an infographic and we do infographics in this class, but you'll notice a lot of themes that we've discussed in this class so far. So for instance, that BMI is not great for necessarily assessing the weight-related risk of obesity. We talk about some of the things that obesity is associated with. Of course, there's a mention of weight bias and stigma, not surprising to see it there. And what we covered this a little bit in the last unit, but just to give it to you represented in a different form, they have outlined this patient journey in obesity management that, as we talked about, starts with a conversation and a permission to even talk about weight. Right? Would it be all right if we discussed your weight? And I love that in this very practical clinical guideline, it gives you a question to even ask someone when you are working with them. Okay. In the second stage, and we talked about this again, we want to assess their situation, suggest using the Edmonton Obesity Staging System. Again, this is more for like a medical associated management, but it might be necessary in other fields as well, but these recommendations are more clinical in nature. And then advise on management. And notice that nutrition therapy is at the top of this list. Exercise below, about 30 to 60 minutes of moderate to vigorous physical activity. And of course, there is talk about psychological interventions, and as we're going to talk about in the next module, the importance of medications and bariatric surgery as part of obesity management. It's not like one or the other, but usually a combined effect of these things can help towards the management of obesity. Agree on goals, not just the doctor or the physiotherapist or the whatever telling someone this is what you need to do. It's got to be agreed upon for buy-in for that individual. And then also assessing and addressing and assisting with that person's barriers to their goals is something that can be helpful too. Okay? So I love it. It says focus on patient-centered health outcomes versus weight loss alone. Love this. I love how these recommendations are framed and presented. Okay, so your reading for this week is going to look at this document that infographic is pulled from. And I like that these recommendations, they also look at things like helping people with obesity make sure that they are, living a life that they feel good about, right? That they're able to participate in their own daily life beyond just physical activity, but be able to care for themselves and experience life like we all deserve to experience it as well. Okay, so again, part of the recommendations is assessment. They recommend the 5 A's framework, which we talked about earlier, and they also make a note about the importance of mental health and also how related mental health or unrelated mental health issues that might show up in a patient with obesity might make obesity management more difficult, especially if that person is on certain medications for mental health related issues that can predispose to weight gain. For instance, can increase appetite or can increase body fat deposition. Okay, so I want you to read through these and get a good sense of them. I don't expect you to memorize everything on this list, but again, I just want to frame what we're going to be talking about more as this unit goes on. Okay. It's important to note that these clinical guidelines also have a particular section that addresses obesity management in Indigenous peoples. We haven't talked much about Indigenous individuals and obesity, but the rates of obesity in the Indigenous population of Canada depends on the Indigenous group, and of course it depends on the nation as well, but in general, the rates of obesity are sometimes 2 or even 3 times higher than in non-Indigenous individuals. And I like that they kind of make some notes about communication about obesity in these populations, because just like other populations that might have been more disadvantaged in certain countries, the Indigenous population of Canada Indigenous people might have like negative beliefs about doctors or people that peg themselves as expert or Western science in general. And there's real reasons for this. There's, colonialism has led to a lot of distrust between Indigenous individuals and non-Indigenous individuals, and we need to recognize this as well. Before colonization, it is believed that individuals that are Indigenous lived a pretty healthy life. They were very active, they used the land to provide food for themselves, and of course I don't want to stereotype, it depends on the people, but it is generally recognized that a traditional Indigenous diet and a traditional Indigenous ways of being was quite healthy. But with colonization, with westernization, there has been a shift in, the foods available in certain Indigenous populations, in certain Indigenous places, and kind of the messaging around, nutrition and physical activity that's really very different than this traditional wisdom that they had that kept them healthy. And that might lead to a lot of distrust between Indigenous individuals and, people in Western science and Western medicine. So some of the recommendations, and I guess, and I expect you to read through this, they really focus on, changing it from like expert to patient, but like changing into more a helping relationship, and tapping into some of the wisdom that an Indigenous person might bring from their own experiences and from their own culture as well. Okay, so I want you to read through those, but I thought it was worth mentioning that, not just with Indigenous people, with any population we work with, we need to realize that people are coming from different places, people have different cultures, people have different practices, people have trauma that is based on a whole bunch of things. For Indigenous people, it's sometimes based on racism or the legacy of residential schools, and this can affect their ability to seek treatment, to want treatment, or to go on something that is like framed with a Western lens. So just something to keep in mind, but always we want to get to know our population, work with them lovingly, ideally, and respect their own wisdom and where they come from as well. Not just always peg ourselves as the expert who knows everything, but to work with people to tap into their own abilities and wisdom to ideally get the treatment that they need. Okay, so we're going to take some of these foundational concepts, and in the next module, we're going to start specifically looking at some nutrition-based recommendations for obesity management.